Good afternoon, Chairman Burke, Ranking Member Antonio, and members of the Senate Health, Human Services, and Medicaid Committee. My name is Jordyn Close. I'm the State Coordinator for Unite for Reproductive and Gender Equity, also known as URGE. I'm a storyteller with Youth Testify, a leadership program of the National Network of Abortion Funds and Advocates for Youth. I serve on the board of Women Have Options Ohio, an abortion fund, and I have had an abortion. When I was 18, I found out I was pregnant when I was 7 or 8 weeks along. That means under this bill, I wouldn't have been able to have an abortion at all. My rights would have been stripped from me before I knew I needed them. I knew immediately that choosing to end my pregnancy was the right choice for me. At the time I was living in Logan County, Ohio, I was surrounded by messages telling me that abortion was wrong. There was little to no compassion for any decision to have an abortion, let alone just not wanting to be pregnant. The last time a heartbeat bill was introduced, and in various anti-choice rhetoric, I've heard multiple people compare abortion to slavery in support of this bill and previous heartbeat bans. It is appalling every time. It happens regularly in this debate, and not only is it stigmatizing like the billboards in my community, but it's disrespectful to my ancestors who fought hard to escape the terrors of slavery and forced reproduction, most of the time choosing abortion because they couldn't bear to raise a child in captivity. To compare abortion to slavery is not only ahistorical, but it makes a mockery of all that my ancestors went through. As a Black woman, I am dismayed every time that this argument is used to deny me and others access to basic health care. Fortunately, when I needed an abortion, I was able to get one. I found the nearest clinic in Columbus, Founders, a little over an hour away from my home at the time. When I got there, I was completely surprised by the level of compassion and care that the clinic staff provided to me. From the woman at the front desk to the nurses that took care of me afterward, their kindness and support reaffirmed the choice that I already knew was right. The most memorable parts of my experiences were all of the people who were in the waiting room with me. I had never been around people so willing to openly share their stories. I have always been hesitant to tell my story so publicly because to me it seems too pale in comparison to other stories I have heard and the lengths those people have had to go to receive basic health care. Transportation, raising money, emotional support, time off of work, gestational limits, those were all things that I could handle. I did have to wait a few weeks to get an abortion, and this bill would have made those weeks impossible, and I would have never received the care I needed. When House Bill 493 was introduced in 2016, I went public with my story for the first time on Facebook. It was too important not to. That's why I'm here today testifying in opposition to this bill. Outlawing abortion will not stop people from needing abortion care. It will just make it impossible and so much harder than it already is for people to get access. Ohioans should not have to travel out of state or even out of their city just to get a 5-minute medical procedure. The right to that procedure should not be stripped from us before we even know we're pregnant or have a moment to weigh our options. The Ohio State Legislature should be protecting our constitutional rights, not passing laws that undermine them. Every single one of you listening to my testimony loves someone who's had an abortion, even though you may not know it yet. I never wavered in my decision. I never questioned what was right for me. I'm happy with the decision I made. I will never regret it. Abortion is necessary, and abortion is health care. Thank you.